to fight against crime. Ronald Masinda, Mthatha.
Well, September marks Fetal Alcohol Spectrum Disorder Awareness Month. 11% of South African births involve FASD, one of the highest rates of this in the world. Aware.org.za and other organizations have launched a campaign to highlight the importance of a healthy, alcohol-free pregnancy. Joining us now is CEO of Aware.org, that is Mokebe Thulo. Thank you so much for your time. It's great to have you here.
Good afternoon. Thank you so much for the platform, and good afternoon to your viewers.
Fantastic. I think first and foremost, Mokebe, let's start with why is this so prevalent, FASD, in South Africa?
I think the biggest problem is the lack of awareness and education, without a doubt. The other problem is that there's so many complexities when it comes to FASD. So FASD intersects with a lot of other social problems we have, such as underage drinking, such as dependence on alcohol, for example, such as the gaps we have perhaps in many of our healthcare departments. And yeah, that is why the number's so high.
Yeah, I want to talk policy here because, you know, if the numbers are so high, when it comes to these policy makers, what should they then, you know, how should they go about in developing and, you know, a comprehensive and a multi-sectoral, if I want to say, policy for the prevention and management of FASD?
I mean, I cannot speak on behalf of policy firstly. I speak on the side of how we can create an awareness and education in order to increase harm reduction. But how do you create a policy for a disease, for example? I mean, FASD is not a disease, but is a disorder. But how do you then say, okay, you can't do A and B? I mean, there's certain things that they can do that policy does spin around, particularly when we're speaking about the cause of FASD, which is a pregnant woman consuming alcohol. Things that include, for example, taverners or alcohol sellers not selling alcohol to pregnant women, or at least women that you can see are pregnant, but that's just a symptom of the problem. It doesn't really get down to the bottom of the problem. So although there are a number of things we can do, such as, for example, improving the healthcare department or the policy, or what happens when a woman walks into a clinic and says she's pregnant, what kind of checks happen, what kind of questions get asked. But again, I'm not the expert in that department.
But let's talk about where your expertise then are, and that is creating awareness. So how do you then go about, especially as Aware.org, to make sure that, you know, this gets the attention it needs?
So, for example, we need partners such as yourselves, such as eNCA. We need the media. We need every partner we can possibly get to get this message out there. The biggest of our challenges is that a number of people do not know about A, the existence of FASD, B, how one passes FASD on to an unborn child, and what one can do to assist. And what we're saying is that the more people know what FASD is, the more that we can attack this problem as a collective. And this is what we're here to do. We're here to raise the voice. And I saw and I see it on your screen now. We're here to inspire people to question, to think, and to act as community members, as the sisters, the brothers, the fathers and partners of those pregnant women, as the teachers in those communities, as the healthcare workers. This is all our responsibility.
And how important is it to get the community involved? And it's not the easiest of tasks, is it?
No, it's not. I mean, it's not one of, for example, those things where you're like, okay, this is the cause. There's a linear route to how to solve this. And as soon as we've got this, then it's solved. It's unfortunately not as simple as that. But what we do is we go out into communities and we start these engagements. So throughout the year, we run a number of programs in partnership with our partner, who is FARR. They are the Foundation for Research Against Alcohol, and they do a lot of work in this FASD space. And some of the work we do in partnership with them. And it's around education, it's around awareness, it's around actual support. How do we support pregnant moms? We've got a Healthy Mother, Healthy Baby program in a number of regions. We do prevalence studies. This is how we get these numbers, firstly, in a number of these regions. And then we do the work to start seeing how we can cut down these numbers. And it's not a hopeless case. This is what we want people to know. The numbers are bad, the numbers are dire, but it's not a hopeless case. It starts here with this conversation right now.
Very important. And when we do look at those numbers, Mokebe, I think, it is important to then maybe also highlight, what do you see when you look at those numbers? What does it tell? What story does it tell when you look at the general population of this country?
It tells the story of a somewhat, I don't want to use the word broken, but a somewhat damaged country that is still healing from the wounds of the past. It tells the story of a country that doesn't know as much as they potentially should or could about a certain issue. And it tells the story of a population of people, that is you and me, that think that FASD is related to the kind of background you come from, whether you're poor or whether you're wealthy, whether you come from a high-income household or not. FASD doesn't care what kind of background you come from. FASD cares that a woman consumes alcohol during pregnancy, and that is it. The only way around FASD, or the only sure way around FASD, is to ensure that a woman has 9 months of her pregnancy without alcohol. And that means that it is 100% preventable. And that is our hope right there, that it is preventable. So it's for all of us to know, what is FASD? How can we prevent this? How do we then spread the messages to the people that need it? I mean, 72% of the pregnancies in this country are unplanned. So you can imagine that impacts the FASD numbers, for example. And that's why we want to run, or we are running this campaign, which is called Reveal the Truth, because we want to wake people up to the truth of what is happening all around them.
And that's exactly what I was actually wanting to get to, is the Reveal the Truth campaign, because this also speaks about education and how important it is to go out into our communities to educate, and it also starts even at school level. I think, high school as well, the later grades in primary school as well, for these kids to know exactly what FASD or FASD is, and how it is a problem in this country. So where do we begin? Where do we begin when it comes to the education and our community's involvement?
We begin anywhere we can, and for us, that's everywhere. Anywhere that we can get access and where there is funding available, we are there. So at the moment, we work quite substantially in 3 of the 5 regions where we do our prevalence studies. And as I said, we run the educational programs. But of course, the younger people are educated, the better it is. But we also know that even when it comes to something like sex education, it is in this country controversial at best in some points. And I think that in order for us to be able to educate our young people, we need to know the truth. So if you walk down a random street anywhere in this country, I would be willing to bet a fair amount of money that if you ask a layman, what is FASD? Many people would not know what the answer to that is, even if you explained it without just the acronym. So knowing that it is not okay to consume alcohol during pregnancy, knowing that if your friend is, for example, pregnant and is consuming alcohol, you can say, hey, friend, did you know that FASD exists? Here's a little bit more information around FASD. knowing that if your friend is perhaps dependent on alcohol and they fall pregnant, you can say, these are some of the resources that I've seen. Perhaps you can look into getting help in one of these ways. So we need to educate ourselves in order to be able to support all of the people around us. And it's not the problem of the pregnant woman alone. It is all of us, as I said earlier.
Yeah. And I think very lastly, because, this also speaks to the massive alcohol abuse problem we have in this country as well. That's also something, that we need to look at, because this also speaks volumes as to why we are seeing, these high numbers of pregnant women that, where FASD or FASD is prevalent. So that's also an issue I think that we need to address, is the abuse of alcohol and the abuse of substances in this country, isn't it?
I think the abuse of alcohol and the abuse of substances in this country have been a problem for a number of years. But I do believe that we should not necessarily confuse the two issues. There are spaces in which the issues intersect. As I said, alcohol dependency. If somebody is dependent on, for example, alcohol, when they're pregnant, the likelihood is that if there is no intervention, they're going to continue consuming alcohol. But these are not the same issues at all. South Africa has an unhealthy, or South Africans as a population have an unhealthy relationship with alcohol, definitely. And this is something that has to be addressed on an ongoing basis. But you don't need to be alcohol dependent in order to give your child FASD. You just have to consume alcohol. It's one of those things where you are not allowed to have any alcohol during pregnancy, and that's it.
Wow. I think there's a lot of education, still when it comes to this very topic. And thank you so much for sharing and allowing us to talk about this as well, and of course also help spread awareness. So thank you so much. That was the CEO of Aware.org, Mokebe Thulo. On to this now. A mother of two has been sentenced to